So I've been listening this morning, and it's been a fantastic morning of challenge and thought. And then I think the impact of one acute inpatient stay on the patients on their long-term conditions management in the community. And it is really hugely important that as part of the pathway of care, we remember that entire pathway, of which the acute care episode might be a fraction of the time, but a hugely powerful part. And what we're looking at is starting with, I don't know if I dare say the word, but a pilot study of looking at the impact of taking health coaching and moving it and shifting it into the acute inpatient environment to look more from a recovery coaching perspective, to start to understand by changing the calibre of conversations that we are playing out across the entire multi-professional team on a ward, how much impact we can have on that patient. And the tack we're taking in the first instance is looking at patients and their maintenance of independence or their retention of independence on a hospital ward. Because a problem we see are patients who spend time with us in acute hospitals, and we can debilitate them quite significantly over that time, requiring them to go home with perhaps more care, greater costs to society. And so the research we're looking into is understanding how, by changing the conversations we have, and we have quite a lot of time with patients, and we can have significant positive impact upon their ability to work in partnership with us. But again, what's played out this morning, most importantly, is our ability as clinicians to work in partnership with those patients. So a huge challenge to us in acute care about how we integrate a much more participative style for our clinicians and for our patients, and be able to start to change dynamic in healthcare to be able to deliver some really significant changes to the societal cost of long-term care, and how we enable patients to continue with self-care as part of whatever their patient pathways may be in the community whilst with us in hospital. So we actually start to work far more in partnership across that divide.